When you reach into a bottle of aspirin and take out a pill, you know that that pill contains 325 milligrams of acetylsalicylic acid, which is the active ingredient. And studies have been shown that taking 2 pills roughly every 4 hours will curb pain. That's solid scientific evidence. Now, when we look at a herbal supplement like Fenugreek, it's interesting. I mean, it has a reputation basically to reduce blood sugar, that is to have an anti-diabetic effect, and also to increase lactation. For mothers who have trouble producing enough milk, they will take Fenugreek. However, the story here is quite different from the story here. What you have in each capsule here is some ground up seed of the plant, roughly about 600 milligrams. But herbs are different from single active components because they are composed of dozens of different kinds of compounds. And depending on where they're sourced, they can actually have a different composition. Is it possible that it lowers blood glucose? Well, there have been studies done on it, and the suggestion is that the fiber that is contained in these pills is effective in lowering blood glucose. If that's the case, there are better sources of fiber. But the real interesting question is whether or not Fenugreek can be of help in improving milk production. The evidence is largely anecdotal. There are no solid clinical trials that will tell you how much to take. So it's not the same thing as telling you to take 2 pills here will reduce pain. That's solid evidence. Here, it is really quite different. If you listen to the German authorities, where herbalism in Germany is quite advanced, they tell you that you need about 6 grams a day in order to increase milk production. Well, each of the pills in here, and I'm just using this particular one as an example, there are numerous Fenugreek supplements, you will take, according to the instructions, about 3.5, 4 grams. Now, the most solid studies, and even those are not so solid, will tell us that in order to have improved milk production, you need more than that. Another way of telling whether or not you've had enough of this, they tell you to smell your urine, because Fenugreek will put some maple syrup-like odor into the urine, and you'll know that you have enough when you can actually smell that in your urine. It doesn't sound to me like a very scientific way of going about it. Is there any risk with this? Well, Fenugreek is in the same family as peanuts, and in rare cases, there have been allergies. People who have allergy to peanuts will be allergic to Fenugreek. But if anyone is having trouble producing milk, they should consult a physician about what to do. And the physician may say, all right, give Fenugreek a try. But you should understand that herbal supplements are not regulated the same way as drugs, and that we don't even really know what is in there. There are dozens of compounds found in Fenugreek, which are really predominant in here. Nobody really knows. One of those compounds is diosgenin, which is a natural estrogen, so it's possible that it can actually increase milk production. But it is kind of a crapshoot when you're playing around with herbal products.